Hi there, folks. This is Dr. Ellenburg. Welcome to our medical show here on Fox News Talk 1020 AM, 95.5 FM. We're also online. You can live stream us through your computer, of course, at foxnewskoan.com. This is a live call-in medical show. Your calls are welcomed and encouraged. If you have questions about medicine, if you have questions about our medical topics, please give us a call here at 522-1020. It's 522-1020. Some reminders. In a week, you will find me at the Ellenburg Center for Natural Medicine. Our phone number is 563-2366. Our website address is drellenburg.com, and that's DRELLENBURG, drellenburg.com. List of our services. We have suggested websites for you to visit to learn more about things out in the world that affect your health. Also some suggested reading on a part of our site as well that you can learn more about. And, of course, we do have archived radio shows, and one goal of this year is to be getting more up-to-date ones on there. I know some of them are on there. If you've been there before, they're older, but there's still some good ones, so please check them out. They are free to download, listen to, and that's drellenburg.com. I do see patients in Kenai and Palmer's at certain times of the month, and give our office a call at 563-2366 for times and dates. All righty, well, what's on the docket today? Well, we're going to talk a lot today about dietary approaches for a variety of things, but the main thing is going to be talking about cancer and diet. We're going to discuss diabetes and its relation to cancer and its diabetes risk in general, especially in children. There was an article that appeared in the Annals of Internal Medicine last fall, here in September, discussing organic foods, and conclusions were basically that, hey, it doesn't matter if you eat organic or not. There's no big difference, and there's certainly that is not the case. We're going to discuss some various aspects of that research as to why some of their conclusions were not correct, and we'll get into that. We'll talk today, too, about vitamin D and its link to eczema, which can happen in children quite frequently. Discuss some nice supplements that are really good for your brain, such as vitamin D, probiotics, and omega-3 fatty acids. And this is something else I'm going to talk about today. I'm sure it'll pop up. Oh, that, and of course we said dietary stuff, but in relations to caloric restriction. So when we hear that word, a lot of us go, what does that mean? Well, caloric restriction is talking about reducing your amount of calories you intake to one, either for health purposes. In this case, there's a lot of work just beginning to start and looking at cancer, and we'll get into that as well. But let's start off today with diabetes. Again, is Dr. Michael Ellenburg. If you have questions about your health, our number here is 522-1020. We encourage your phone calls. You don't have to call if you don't want to, but I got plenty to discuss today, but I don't have a problem taking a break and talking to you about your health or your health questions. Again, our number here is 522-1020. So we had an article that appeared in JAMA, which is the Journal of the American Medical Association, appeared late last year, talking about a very interesting term called exercise dose. An exercise dose in relations to diabetes risk in children who are overweight. And certainly this is a big deal. In our country right now, over 1/3 of the population, if not more, is overweight, and a good quarter of that are obese. That means they have more weight on them, unfortunately. And we're seeing a lot more children these days having trouble with their weight early on, and a lot more children are definitely having weight issues, more, I would say, in the sense of overweight versus obesity in childhood. But the biggest thing is exercise. And we hear the word exercise dose, and I don't know about you, but if I can think back to grade school. I grew up here in Alaska, over Bayshore Elementary, and I know that at lunchtime, I think it was after we ate, we went outside. It was like 45 minutes, a long recess. And then around 2 o'clock in the afternoon, we had another recess for 15 minutes. So we had about an hour a day, and that was not gym. And gym was a couple times a week, and that was like 45 minutes to an hour as well. So I don't think this can be argued. We had a lot more physical activity back when I was younger. I know some suggestions of why that's happened is because we've changed the curriculums in school to where we're teaching things now in fourth grade that I was learning in grade 6. Well, so be it. But at the same time, I don't know how much that is actually helping, because I saw a recent stat that said that most high school seniors only get to about Algebra 2 when they're in high school. And I had some good friends and myself, we took calculus, and I took Algebra 2 in 10th grade. So the reality is, I'm not going to say, well, we were learning more, and so therefore we eliminated some physical activity, and that was a good thing. I don't think that was a good thing at all, to be honest. But the reality is, and it's a very true reality, is that we have much more children these days overweight, and for sure there is less activity in grade school, especially with activity outside, running around, being a kid, having a good time. All right. Well, exercise dose in this study was looked at, and what that looked at was the amount of activity. And it was a 4-year study, and they had children literally assigned to certain groups. And the one group was the low-dose exercise. That was 20 minutes of aerobic exercise daily. And then we had a group that was a high-dose group of 40 minutes of aerobic exercise daily. Again, it's in children. And there's a control group that had no specific exercise intervention and just did what they did, went to school, normal stuff. And the kids' age ranged from 7 to 11 and included a group of approximately 220 students from 15 schools in the U.S., and then the main 2 states were Georgia and South Carolina. And they were screened for the Center for Disease Control's prevention criteria for obesity. It looks at body mass index, which BMI is a much more, can be a better way of assessing someone's obesity or not obesity or even overweightness, and we can use that word. And also looked at people who are engaged in physical activity that was at least less than 1 hour per week. And so that had to be part of the protocol. And had no chronic medical conditions and that otherwise affect the results. Well, and what they found, as would be expected, is that the groups that tended to have more exercise, they tested the children with what's called a glucose tolerance test, which basically you're given a very sugary drink, blood is drawn on them initially for a kind of a random glucose sampling, and then they're given the sugary drink, and 2 hours later, their glucose, blood sugar, same thing, glucose levels were measured again to see where they're at. And what was kind of surprising is that there wasn't a whole lot of difference between 20 minutes and 40 minutes in the first and second groups, not in the control group, in the first and second groups. And they also had the children give them dietary information as well, which wasn't so much covered in this particular study. And what they found out was what? Well, they found out that compared with the control group, those that did nothing other than what they already did, which is 20 minutes a day of this school activity, both exercise groups, the dose was just as equal with 20 versus 40 minutes. And they had a greater improvement, of course, minor and better improvement in the group that's 40 minutes a day versus 20 minutes a day of aerobic exercise. And body fat was reduced by 1.4% in the high-dose group, and in the lower dose group it was about 0.8%. And, we bring these things up because it seems very simple. I mean, to many of us to suggest, hey, exercise is good for you, we should be doing it, right? But I think it's important that when we can actually find studies that demonstrate it actually is effective and can do something for us, it's extremely important. And, whenever I see a patient with any problem they have, unless it's a physical problem of movement where they've got a bad knee or shoulder, most of the time it's ambulatory where they've got a bad hip or a knee or an ankle, and they really can't do some good exercise, everybody's going to hear the discussion of, are you exercising? How is your diet? And these are the mainstays of medical treatment, no matter what doctor you see. If you see myself, who's a naturopath doctor, or you see a medical doctor or a DO or a chiropractor, for that matter, the focus needs to be on what are we eating and are we exercising. That's just the basis. And then anything beyond that. We talk so much about, for example, how vitamins don't do anything in some of these studies I presented here on the show over the last several years. And most of the time these studies are handpicked to find the ones that really didn't show much of an effect. Well, the reality is, what else are those people actually doing? If you expect by taking some vitamins, 4 or 5 a day of something of this or 10 of these things, and you're not exercising and you're not eating right, those vitamins are going to do nothing for you. Okay? That's how important this is. I'm a huge fan of supplementation, and I promote it. I'm all about people taking, various nutrients for a variety of conditions or just for overall prevention. But if you're not exercising, you're not eating a good diet, those supplements aren't going to work like they're supposed to in your body. Okay? Extremely important. And the part of the story, again, is getting back to diabetes, is that we want to see people have less diabetes. And the problem is we're not seeing that. It's going up and up and up. And it's going to tax our healthcare system. We're all going to be paying for that in the end. In some direction, you're going to have higher insurance rates because of a majority of the population not being healthy. And we do know that a diet and also exercise specifically can enhance your insulin sensitivity in the body. And it's never a bad thing to review that. And again, some reminders here. If you want to call on any questions right now, or if you want to change the topic altogether and something else in medicine, that's fine too. 522-1020, 522-1020. Please call if you'd like. But with diabetes, it's important to understand what happens to when we do have diabetes, what's really going on. And again, it's as far as we understand it as at this current time. Remember, we don't know, and this is for everybody in medicine, we don't know a giant amount about the body, maybe 10% of the voluminous information that could be out there, which is a lot. But we have a lot more to learn. But at this point in time, we do know some concrete things that we tend to focus on with diabetes, and that is in the body, first of all, sugar, glucose. Glucose is stored, main storage sites, in your liver, your fat, and your muscles. And when you are finally diagnosed with diabetes, you've had a process going on in your body that just didn't happen overnight most time. Unless you have type 1 diabetes, that's a different story. Type 2 diabetes is not a different story. It's a process that when you develop type 2 diabetes, you've been working on this for quite some time, maybe even 10 years for that matter, maybe longer. And it's where your cells are no longer sensing insulin. And insulin comes from your pancreas, from the islet cells. They're called the pancreas. And insulin is telling the body to store sugar, glucose that is, and the main storage sites being, again, the liver, the fat, and the muscles. And it's when these storage areas in those parts of the body start not sensing insulin like they used to, or insulin resistance is a good word to use, a description for that, we then start seeing an increase in glucose in the body, and more so in the blood. And then eventually, if it gets high enough, you end up getting more full-blown symptoms. Maybe you have, urinate a lot, you're thirsty a lot, you're not losing weight. Then all of a sudden they get checked out. Hey, I've got diabetes. Before that, you may have been developing high cholesterol. You may have been developing, high blood pressure. Insulin, when those cells are not sensing at the liver, the fat, and the muscles that glucose, what begins to happen is that the body has to make more insulin. Well, what that does is create a couple of problems. One, it increases insulin secretion. And so that also increases the retention of sodium in the body, which can also increase water, which does what in the pipes in the body called the arteries? It increases the pressure. So blood pressure can start going up, and that can be a very early sign of prediabetes, insulin resistance, or a metabolic syndrome. It can be called all those things. And so there's one piece. The next piece is if you have more sugar around than not at certain times, your body's going to start trying to burn that preferentially, and your ability to burn fat is going to change in your body. And your liver has to do something about that. And so what happens then is it might start making more cholesterol in your body because of that reason. And so in this case, cholesterol going up may have, it's got something to do with your diet for sure, but the reality is the underlying problem is that if you're insulin resistant or pre-diabetic, you now have increased levels of cholesterol taking place. You may have high blood pressure in your body taking place, and you're working your way towards having full-blown diabetes, and those could be the early signs of that. We also know that if this is taking place, you're also possibly increasing your risk of developing cancer, even if you end up with cancer as well because you already have diabetes. And there's been some very interesting work looking at a lot of that data. And with type 2 diabetes here, specifically what we're talking about, type 1 diabetes is an autoimmune condition where for some reason, your immune system attacks those islet cells in your pancreas and kills them off. And now you don't make insulin. It's like to be on an insulin pump the rest of your life to maintain that. You can also still get help with that with a variety of supplementation to help enhance that insulin that your body's getting through a drug, but help work better. Things like chromium, things like vanadium, or certain herbs like Geneva sylvestre or bitter melon. There's various things that can help that out, that process. But in looking at cancers, we have a huge concern about that. And just a couple of weeks ago, we saw an article that came out and said cancer occurrence is down. No, it's not. Okay, I mean, I wished it was true. I would be here ringing a bell and jumping around. It'd be great because I see a fair number of cancer patients. I would like to see less cancer patients because meaning cancer is getting better. That's what I mean. Less of it's occurring in the population, but it's not. It's increasing. And why would there be a study saying that it's gone down? Well, if you knew how research papers and information is put together, and I think I may even comment on this a couple weeks ago, is that on a death certificate, the doctor does not always write down cancer. They may have died with something else that was related to the fact they had cancer. And so that's not put into the medical record database as to why they died from cancer, for example. But anything we can do to prevent it, the better. And in one area of prevention, of course, we need in treatment is looking at type 2 diabetes. And, in 2012, they did a very big study out of Australia. And it was a long-term study, so from 1993 to 2010. And they found that in people who had type 2 diabetes, there was about a 23 to 30% increased rates of cancer, all sites among men and women in the body. And specifically, there were certain type of cancers they saw on the increase. Pancreatic cancer, liver cancer, endometrial cancers, colorectal cancer. So there are many other areas. I mean, all cancers were affected to some degree or not, but specifically those cancers were very much increased. And so the question becomes then, why would you even have an increase in cancer if you had diabetes or if you had prediabetes? And there's a number of different things taking place in the body. And again, you need to realize that all of medicine put together, everybody put together, we're still trying to figure out a lot of things about how the body actually works. And certainly with cancer, that's a big one. I'm reading a really good book right now that, unless you got a degree in biochemistry, you're going to find it pretty daunting to read. But it's a great book called Cancer Metabolism. And it's written by a geneticist and basically a biochemist, teaches at Yale, and has written many articles on cancer. And his discussion is looking at specifically at cancer metabolism. What is going on in tumor cells that's different than normal human cells? And how does that lead to, or how can we approach that actually as a cancer treatment itself? And one thing to understand about cancer, and if you're a regular on this show, you've heard this before many times, but it's worth repeating, and that is tumors' main fuel source is glucose. They eat sugar. That's what they eat, okay? They eat very little fat and very little protein. They eat sugar. And they do that because it allows them to run a process so in every cell in your body, you have these little batteries, okay, and they're called mitochondria. And even cancer cells, which were once normal human cells, even tumor cells have mitochondria to help run their process. They need energy to grow and do their thing in their cells, just like our cells that are normal need mitochondria to make energy. And they all make the same energy called ATP, or adenosine triphosphate, and that's what runs the energy in these cells. It's like the battery acid running the energy. That's the energy part of these mitochondria. And the problem is how they actually are doing that. So there's an aberrant process taking place within the mitochondria in the cells where we're actually using glucose, and through a fermentation process, and also through increased glycolysis, that means actually breaking down glycogen in your body, which is a storage form of glucose, to make more glucose. We're giving these tumor cells, more of the energy source they need to make the energy that runs the entire cell. I know it's confusing, but the route we're getting back to here is this is why it's the utmost importance for a couple of things. One, if you have cancer or know somebody who has cancer, it's important they're on a low-sugar diet. There is no reason not to be at all, unless they don't want to treat it and they just want to do what they want to do and they're going to let it get them and they're going to, unfortunately, die from having cancer. But if you want to try and beat it, fight back, the first piece, as usual with any disease condition, right, is exercise and diet. And this piece is diet. Low sugar, okay? Don't give tumor cells more of what they need to grow, okay? And yes, your body is using blood sugar, your glucose levels is using glucose for itself as well, but the tumor cells are using it much more. And the reason that is that a normal human cell and a tumor cell, you have these little doors on top. We call them receptors in medicine. And there's many more receptors for insulin on cells, tumor cells, than normal human cells. And why is that? Because that's going to allow insulin to open up the door and let glucose into tumor cells and normal human cells. But tumor cells have much more of these receptors or doors on them to be open to let glucose in so they can get bigger and keep growing. That is their major fuel source. So, if you ever have a family member who's got cancer and you talk to them, say, hey, what did the oncologist say about your diet? And hopefully that oncologist told them, hey, you need to go on a low-sugar diet. Just start with that. It's the simplest thing to do. Even if most doctors who don't know a whole lot about nutrition just said that following, just say, you know what, you need to be on a low-sugar diet. That'd be a great place to start with. And it might help a lot in the long run for these patients to have an idea of what to be doing. Now, on top of that, they should recommend exercise, because I've discussed several articles over this last year, at least 2012, that have talked about how exercise at any point in the cancer process in humans is helpful, other than the fact that if they're not in remission, it's a different story. But anybody before they have cancer, while they have cancer, in remission, all those times it's important because it affects the body's ability to fight back. It affects the immune system. Want to strengthen the immune system? Guess what? Exercise can strengthen your immune system. It can. People who exercise quite a bit when they get a cold, tend to fight it off pretty fast than those who don't exercise. And I know this because I've been doing this over 10 years, and I see people with colds and flus and all kinds of chronic conditions all the time. It just makes sense. The healthier that system is, the easier it is to fight off infections, fight back, right? If you want to think about how to prevent the flu, exercise instead during flu season instead of not exercising during flu season. Skip that flu shot. Oh, and by the way, I'm just pausing. I have to mention this. So, I'm not against Dr. Oz. In fact, Dr. Oz I think he's on NBC. 4:00 in the afternoons, weekdays. I think that's when he's on there. He has a lot of good things on his show, but one I don't watch mostly. My wife likes to watch it, so DVR it. We'll watch it together sometimes. And I guess Pierce Morgan was on there about 2 weeks ago, and he got a flu shot from Dr. Oz on national television. And 10 days later, guess what happened to him? He got the flu. And yeah, he probably got it from the flu shot. So I know many of you out there probably get the flu shot on a regular basis and don't get the flu, but guess what? It can happen. And I'm not going to go into all the data I've talked about over the last several years I've been on the radio. The flu shot's worthless, but it is. Your best chance of combating the flu is to do things to keep your body healthy, to fight back so you don't get it at all in the first place. And the flu shot is not going to keep you from getting the flu. What it might do at a minimum, or the maximum, is if you did get the flu, it may not be as intense for you. The severity of it may be less. Maybe. Okay? But there's not everybody in the world gets flu shots. Did you know that, by the way? U.S. is like the main place in the world that does this. Most places don't do this. Okay? And guess what? The flu death rates are still the same. All right. Well, getting back to, so we got about, 2 minutes till the bottom of the hour break? Okay. I don't want to go into the next piece. I want to talk about caloric restriction and cancer, but I want to, after the break, we'll get into that piece. But one thing I do want to again bring up is this discussion in looking at diabetes. So if you have type 2 diabetes, one thing I want to encourage everybody out there: if you have type 2 diabetes, try and get it under serious control, because if you're not, you're increasing your chances of cancer by at least 20, even 30%. Okay, you don't want to do that. You really don't want to do that. Okay, that's not what you want to be doing. And believe me, you can. Type 2 diabetes is not forever. It can be forever in a patient, but it's not forever. Diet and exercise, and yes, even supplementation, not even drug therapy for that matter, can get a patient back to a normal homeostasis process in the body. They don't have type 2 diabetes at all. It can be done. Believe me, it's out there. If you don't believe, just watch a season of The Biggest Loser on TV sometime. You'll see that. People come in there's place, and those who stay on the show the whole way through, many of them get off all their medications after they've been there for a few months. Pretty impressive. So it can definitely be done. Not a question about it. Vitamin D. Let's say a little bit of that for the break. We got about a minute, and then we'll come back and talk about caloric restriction and cancer and organic foods. But again, vitamin D is important to remember, folks. We're still on that timeline with vitamin D. Here in Alaska, it's time that we're not getting any vitamin D from the sun at all. Zero, zilch, nada. And, unless you're going to Hawaii or somewhere warm where the sun is out, you might get some vitamin D in your skin made there while you're there. But right now, you're not going to. So make sure you're taking at least a minimum as an adult, 1,000 IUs a day, 2,000 IUs a day during the winter. And best yet, test your vitamin D. See where you're at. All right, folks, that's the sign. We're going to the bottom of the hour break here. We'll be back in a few minutes. Hang on then. Turning blue all over the windows and the floors. Hi there, folks. This is Dr. Ellenburg. Welcome back to our medical show here on Fox News Talk 1020 AM. Also find us on FM at 95.5. You can live stream us on the internet at foxnewskoan.com. That's foxnewskoan.com. If you've got questions about medicine, questions about our topics today, our phone number here is 522-1020. It's 522-1020. Well, just coming back today, we've been talking quite a bit about diet, diabetes, and cancer specifically. And one thing that we're starting to get some very interesting, and I see a fair number of cancer patients. So whenever I see things and a dietary way to be treating cancer, it really piques my interest because, as I mentioned before and a couple times today, is low sugar diet if you have cancer, right? Because sugar is what feeds tumors. That's their fuel source. Well, last month, as they point out in this article here that appeared, what was it in? It wasn't in. Oh, it was in the journal. It's just called, the journal's called Oncologist. That's the name of the journal. It said cancer research was quietly made at an American university in January. And what's going to be done is that for the first time ever, a controlled trial is going to look at caloric restriction as a treatment for cancer and measure outcomes in cancer treatment. What is caloric restriction? That means eating less calories. And there's been a lot of data over the years, not with cancer, but just in general, about the benefits of eating a lower calorie diet on a regular basis, just for health reasons. There's even been the discovery of some certain genes in our body called sirtuin genes, sirtuins, sirtuins. And supposedly those are supposed to be sirtuins genes are turned on by people eating diets that are low in calories. It turns these genes on that have effects on our longevity through our immune system, through our cellular breakdown in our body and metabolism. And the study is going to be done through Duke and is going to look at basically people eating less and what are the outcomes going to be. And there's been, like I said, there's been a review of these sort of things over a period of time. There was a review that came out here in the Journal of Nutrition and Metabolism that came out in 2011 and looked at the possible role of restricting carbohydrates in preventing cancer or even in the treatment of cancer. So those who are, say, receiving chemotherapy or radiation, but also having them on a very strict diet that limits their amount of sugar, and carbohydrates, once they go into your body, are turned into sugar eventually. So a low-carb diet, low-sugar diet as being a suggestion of things to be doing. And one of the ideas is that suppressing carbohydrates, eating less of them, could actually result in suppressing or slowing cancer growth. And there's a lot of laboratory research that actually supports that specifically. And as I mentioned before, and I'm going to kind of read part of this here in their statement, it says, first, contrary to normal cells, most malignant cells, that means tumorous cells, depend on a steady glucose availability in the body for their energy and for generating their biomass, increasing their size. And are not able to metabolize or use various amounts of fatty acids or ketone bodies due to the fact the way their mitochondria are not working. Okay? This is an area where things have changed within the mitochondria, the cells, the batteries inside the cells, tumor cells, and even normal human cells that make energy. But there's dysfunction among the mitochondria in tumors, and that's really a big deal. And we can target that if we can limit the amount of glucose, limit the amount of sugar someone is exposed to. And the Duke study, which has not started yet, so this is the beginning, but it's a good beginning, is the Duke study will involve looking at caloric restriction in men with prostate cancer, and specifically looking at them cutting down on carbohydrates. And the people in the study are going to be men who have failed primary therapy and will have an advanced disease progression. So it's going to be in a group that's a very serious type of cancer and try this diet out on them. So they've tried the standard approach, and then they're going to be enrolled in this study and lower their amount of calories, lower their amount of carbohydrates to see what kind of effect it can have on their cancer growth. And about 60 guys will be in the study, and look at this over a couple of years. And the end date of the study won't be till about 2016, but it's going to be a good one. And really looking forward to seeing some data on this. And there's a few more studies coming out as well. Besides this one on prostate, it's also going to have one on looking at breast cancer patients as well. That's going to be done through Jefferson University in Virginia. We got a caller on line one. John, are you there?
I am.
Hello there.
Yes, doctor.
What's going on? Hey, John.
Had a question for you with regards to the glucose that you were talking about. I was diagnosed with prostate cancer back in 2008.
Okay.
And had robotic surgery. And my glucose has always run high, typically over 100, in the teens, somewhere 113, 118.
Okay.
And recently I had the doctor put me on metformin glucophage at 850 milligrams 2 times a day. Now, I mean, how does that work? What's the interaction there between if I drop down my food intake of carbohydrates and sugars in conjunction with this metformin? Because I'm reading a lot through Life Extension Foundation. I'm sure you know who they are.
Sure, you bet. Yep.
And and they're a big proponent of metformin as a way to help to control cancer.
Correct.
And so I was just wondering, what's the is it wise to be, to continue to consume a low carbohydrate diet with low sugar, of course, and then the metformin. What's the interaction there, the chemical interaction?
Sure. So metformin, the one thing about metformin, has been on the market for a long time. It's one of the oldest diabetes drugs currently still in use.
Right.
And what metformin is doing is trying to enhance your insulin sensitivity. So you had type 2, well, you had kind of pre-diabetes type state. So
right.
You still make insulin. Your pancreas makes that. But what the metformin is trying to do is enhance the ability for your cells, particularly at your liver, the fat, and the muscles, to sense insulin. And that's how metformin works, or is supposed to work.
Okay.
Now, the data that's been out there looking at metformin in cancer, or even cancer treatment, has really focused on ovarian cancer. But there's actually a couple of studies in the pike, down the pike, looking at metformin's use in a variety of cancers. And I don't think we've really elaborated specifically, other than the fact that if it's going to enhance someone's insulin sensitivity, maybe that specifically is going to help out normal human cells that are in the liver, the fat, and the muscles to store glucose. Because the reality is, if what we're probably not seeing, which is a good thing, is that you don't want to see metformin enhance sensitivity of insulin receptors on tumor cells, because that wouldn't be good.
Right.
But it's not doing that. And I think by now we'd have seen that in these studies. The one thing to consider, back to you here, that is that, one, having a low carbohydrate diet, but is also looking at, what else can I take that's supposed to help my body out specifically with your insulin sensitivity, and things like trace amounts of chromium, for example. It's a trace mineral. So is vanadium. So there are things you could be doing, on top of this metformin, for example. And if you start doing something like that, you're going to definitely want to be checking your blood sugar, because if it starts working, you may need to even lower your dose of metformin, or call your provider and say, hey, listen, I'm getting lower numbers here, because you can also go the other direction and get hypoglycemia, which you don't want to get that.
Exactly. And a good number, according to Life Extension Foundation, is that your blood glucose should be somewhere around 85.
Yeah. I mean, in my patients, when we do our health panels, we're typically trying to see them have their fasting glucose somewhere between 60 and 90.
Okay.
And the other thing to consider, too, is that has your provider done a hemoglobin A1C on you?
Yes.
Okay, good. And was that normal, or was that slightly out of range as well?
It was slightly out of range.
Okay.
I mean, he did say that, all these indicators, my insulin IR.
Yeah.
He said that was a kind of an indicator of pre-diabetes, as you said, and he said we want to get you out of that phase.
Absolutely.
He's also looking at part 2 of my problem is some heart disease.
Okay.
With regards to the LDL particle size.
Sure.
And we've done the NMR.
That's a good profile. Yeah, that's a good profile.
Yeah, I actually had a doctor here locally do that, and that was one of the reasons she put me on metformin and also some cholesterol-lowering drugs. But I checked out a doctor in Los Angeles, and he's doing some other thing. He changed my cholesterol medicine to Livalo. Have you heard of that before?
I haven't heard that. Is that a new one?
I guess it is relatively new. Yeah.
Oh, okay.
It's not Lipitor. It's not Crestor. It's Livalo in conjunction with Zetia.
Okay.
And
there's different ways of, besides, statins work at inhibiting the ability of your body to make cholesterol, but you can also take other cholesterol drugs that can bind cholesterol, and in your intestines, so you literally excrete it, so you don't absorb it.
Right.
So there's different ways of doing that. The biggest thing for you, I'd say, long term, is if you can get your sugars in a better area, glucose in a better area, you can get off of those kind of drugs for cholesterol, because the cholesterol part really is a secondary effect of having metabolic syndrome, which you have, which is just pre-diabetes.
Okay. It's kind of funny too, because this guy in California, he's an MD, but he thinks outside the box like you do. It's just different for a lot of MDs are stuck in that regular conventional train of thought.
Well, and unless they're learning something differently from what they're being taught in school or in their specialties and looking in integrative medicine, they won't be using anything differently because they don't know about it. So
Exactly.
that's the problem, unfortunately. So.
Okay.
Okay. Well, thanks for the call. That was good stuff, John. I appreciate it.
Okay, we'll talk to you again.
Okay.
Take care.
Bye-bye.
Bye-bye.
Bo, are you still there on the phone, Bo?
Hi.
Hello.
I have a couple quick questions.
Sure.
What do you suggest for a 12-year-old girl who has had type 1 diabetes for 8 years? The problem we're having right now is with insomnia and restless leg syndrome at night. All the prescribed medications are not recommended for children, and I'm really not quite, happy with the side effects that they have. Do you have any natural suggestions that we could use for her?
Well, a couple of things you could try that shouldn't interact at all with what she's taking, and one would be considering some magnesium. Magnesium is used in the body for over 300 reactions. Magnesium also has shown some benefit in diabetes. So it wouldn't be a bad idea to try that. In a child, you need to get exact dose, but a small amount of the RDA for an adult for magnesium is around 350 milligrams. So something on the lower end of that magnesium closer to bedtime might be helpful, and it might even help rest the legs out as well.
Okay.
Does she? So she's on insulin, obviously. And
yes.
What else is she? Medication is she taking?
That's it.
That's
just
it.
Insulin.
Just insulin. And what are her fasting and blood sugars like?
She actually, with her age of 12 years old, and with her going through puberty as she is,
Yep.
We've really had a rough time with her blood sugars.
Okay.
She wears a pump, and to be honest with you, since we've gotten the pump, I don't know what we're doing. We can't seem to get it right. But her blood sugar's usually pretty high. Fasting blood sugar maybe 160.
Okay. All right. Well, that could be a lot higher than that. So I mean, it's high, but people can have 300 and 400s too. So I'm glad it's not that high. But you also can consider at some point in time looking at our previous call there. We're talking about some trace elements that one thing is, with your daughter, obviously she's not making insulin because the autoimmune condition has damaged her pancreas. She can't make insulin. But it doesn't mean you can't look at things that might help the liver, the fat, and the muscles. As for glucose, main storage area in the body is where glucose is stored, help them do a better job of that. Okay.
Okay.
And things like chromium, which is a trace mineral, vanadium, which is another trace mineral. There's even some different herbs that can be used for diabetes. They could be something to consider. You probably want to see somebody get this part started, but it could be something to help out the condition a little bit further and might help in conjunction with the insulin get things working better.
All right.
And then obviously diet. That's a huge piece. And she should be
eating
course. Well and definitely exercising. Okay? So,
yes.
But the magnesium is one. I want to say one last thing about the sleep thing. Low-dose melatonin might be helpful as well. So.
All righty. Thank you so much.
Yeah, you're welcome. Thanks for the call.
Thank you.
All right. Bye-bye. Okay, we got one more here. Sandy, are you there?
Yes, I'm there.
Hello.
Hello. I was just listening to your last segment, and in my early 50s, I'm been battling some weight issues for the last 20 years. And then my husband has had cancer, and I'm just wondering, why do I even bother to go through, like, the whole grains and all that kind of stuff? Shouldn't I feel like I should just, like, eliminate them for a while. And, you hear all this stuff about how whole grains are good for you and all that, but the more I hear about carbohydrates, the more I think I should just get them from fruits and vegetables and call it good.
I don't think that's necessarily a bad idea. I mean, definitely more from the vegetable side of things because you're going to get complex carbohydrates. And as far as, other grains, I mean, a lot of people do very well getting off of gluten, which covers a vast category, more on the side of wheat. But, brown rice is a complex carbohydrate you could use instead of regular rice. Pasta certainly is not a good choice for people eating because they have lots of carbohydrates in them. You can get whole wheat pasta. But, again, some type of elimination for that for time isn't necessarily a bad idea. And enhancing your insulin sensitivity in your body can help with weight loss. It's also important to remember, too, I don't know if you've had a problem or not losing weight for some time, is that you could have a thyroid problem as well. So don't forget about that. And also a reminder on the thyroid piece is just because your thyroid labs are normal does not necessarily mean you don't have a thyroid problem. And if you could spend some time poking on the internet, you'll find some sites where you can do like a thyroid questionnaire. Fill one out sometime, and just see what comes up.
I have your packet to fill out to come see you as a patient, but I'm a huge procrastinator.
All right, well, that's okay.
I'll get there.
The food stuff's good, though, so yeah, I recommend trying some elimination. And the one thing that if you do eliminate some grains for a while or eliminate, wheat for a period of time, a very important piece is when you try and put it back in, do a test with it. And what I mean by that, for example, let's use wheat, for example. So you're off of wheat for a couple of weeks. Say, okay, now I'm going to eat some bread one day. I'm going to have some pasta because it's going to be wheat inside that, right? It's in rich flour typically.
Sure.
And then you wouldn't eat any more wheat or anything, different kind of foods you haven't been eating for 3 or 4 days and see how you feel. Okay. And it's called elimination and challenge with looking for food allergies basically. But you don't have to have an immediate reaction with the food to have a problem with the food. And that's been a hard time for a lot of people to understand because most medical tests, most of them, are looking for immediate food reactions, and they don't do a very good job of finding ones that are called a delayed reaction with foods. So use that experimenting. I'm totally fine with doing some diet modification before you come in. You might find out some things that are really important that can affect a lot of things.
Okay, great.
Okay.
Yes.
All righty. Well, thank you for the call, Sandy.
You're welcome.
Appreciate
Thank you.
it.
Bye.
Okay, have a good day. All right, it's the red letter day, folks. 3 calls in a row. That's fantastic. All right. Well, we've got about 7 minutes left in today's show. If you want to keep calling, go for it. It's 522-1020, 522-1020. I need to comment on an article that I did not talk about originally here on the show, but I did find the rebuttal to it, which I found interesting. And it's a journal I belong to called Environmental Health Perspectives, a phenomenal journal on what things in the environment affect our health. And it's very sciencey, so unless you want to read some detailed stuff, don't worry about reading it. I'll tell you what I found. But their title was Organic Food Conclusions Don't Tell the Whole Story. And so in late fall of last year, the Annals of Internal Medicine looked at an analysis of over 238 studies, and that's a term called a meta-analysis. Most of this study was looking at nutrient content of organic foods, viral, bacterial, fungal contamination of organic foods versus conventionally grown foods. 9 of the studies in this 237 reported discussions on pesticide residues, including 3 studies that demonstrated exceeding federal limits. And they were included in the analysis, but not much was really talked about this. And the lead author is quoted as saying, and it was Dina Bravata, said, there isn't much difference between organic and conventional foods if you're an adult and making a decision based solely on your health. Well, and one key finding they have here that the team reported on this previous study that there's a 30% difference between conventional and organic produce, meaning organic produce had a 30% lower risk of pesticide contamination than conventional produce. Now, this risk difference doesn't really play out well, folks, in the numbers. And the reality that I think that we can get from this is that, I could probably agree with that, nutrient value, and again, it really depends on who's growing the food here, okay, that, and not all organic food is created equal, because I know I've got people listening here who do a great job of growing their own food. They're putting all kinds of nutrients and great things in the soil, and it's organic. They're going to make some nutrient-dense vegetables that are going to blow the socks off of somebody's organic, tomato that they grow, thousands of at some big factory somewhere. Okay, so I understand that piece, and I do agree that you probably could on certain organic foods have higher nutrient content. But the point they're trying to bring out, which is a great point, and there was a rebuttal written, and it was accepted actually into the Annals of Internal Medicine for this next month, looking at this issue over pesticides. And Dr. Ben Brook calculated a 94% reduction in health risk attributed to eating organic foods, specifically in those ones that had the highest amount of, he says the word, pesticide-intensive fruits. Now, if you haven't heard the show before, I do talk on the show many times about a great site online, environmentalworkinggroup.org, EWG.org is a website, and they have the Dirty Dozen. And it lists out, what if you can't eat organic, what are the best fruits and vegetables to be eating, and if you if you're going to be buying foods and you want to avoid the highest pesticide-intensive or pesticide-laden foods, here's the ones you want to avoid, top 24. Number 1 on that list, by the way, are apples, which are great for us, but they're also the most heavily laden pesticide fruit out there. And that if you were going to eat organic, you're going to be less exposure to pesticides in the long run, okay? And your body has to deal with that in some form or fashion. And the biggest thing is that a lot of pesticide studies that have gone on over the years, and even up till now, say, well, the levels in these amounts are so small, it's not a big deal. Well, what we're starting to find out is it's not a question of like here and there. So if you're eating a lot of fruits and vegetables because they're good for you, and they have to be heavy laden with pesticides, over the long term, you're going to accumulate these things in your body. And a lot of these pesticides are actually stored in your fat in your body. So it's hard to get rid of. And long term, we're starting to see a lot of things being connected with pesticide residues in people's bodies and what they're being exposed to. I mean, all these different toxins that we're being exposed to from our food. And here's one area you can make a big difference. And it was nice to see that in a report from the pediatrics, the Academy recently recognized that our organic diet, definitely reduces exposure to pesticides and may reduce diseases associated with antibiotic resistance. So if you're eating more free-range food, it's not being used with steroids or antibiotics, you're being exposed to less things that way. And a lot of the antibiotic resistance that we're seeing, and I don't mean on fruits and vegetables, I'm talking about meat now, like chicken and beef, for example, and antibiotics are used on those type of chickens and cows because you want to limit the amount of infections they're going to get, especially diarrheal infections, because that tends to make them less healthy animals. So they give them antibiotics to kill off the bacteria that might cause them problems. Because it ends up in the meat too, folks, and you eat that, okay? And so that can also increase our resistance to antibiotics as we get older if we're eating more of those kind of foods. So definitely we need to consider that in looking at organic foods, you can't downplay that. I think the reality is you can get the problem is it's expensive, and certainly in Alaska, unless you're growing your own fruit and vegetables in a greenhouse year-round, it's very hard to get at certain times your organic foods. But that site, at least ewg.org, print that out. I mean, if you're big into fruits and vegetables, and we all should be, by the way, you want to be getting things for you and your family that aren't heavily laden with pesticides, okay? And the argument we always hear, well, even if they are, the benefits outweigh the harm. Well, that may not be the case. And that's where we're starting to see things going next in this direction of talking, well, who cares if apples are loaded with pesticides? There's so many good things in there that will outweigh the benefits. The benefits will outweigh the risk of eating pesticides. It may not, actually, in the long run. So really consider organic. And yeah, apple costs $3 for organic apple, but guess what? Your child or you are not getting more pesticides inside your body. I mean, all of us got DDT in us, right? You sprayed back in the 50s and 60s. I wasn't alive back then, but guess what? I have DDT in me, and so does everyone I'm talking to on this radio right now. Okay, it's pervasive in the environment, these sort of things. So we want to limit our exposures to these. It's a big, big deal. Okay, well, we got about a minute. We got a minute left. All right, well, some reminders before I get off the air here, and then I'll say one more parting comment here on vitamin D. During the week, you'll find me at the Ellenburg Center for Natural Medicine. Our phone number there is 563-2366. Our website address is drellenburg.com. And again, on our site, we do have links to the Environmental Working Group site that has that information on pesticides in fruits and vegetables. And we also have several good links on there about vitamin D3 and a variety of things out there that do affect your health and can learn a lot more. So check our site out at drellenburg.com. I'll be back next Monday with much more information. Again, folks, thanks for those great calls and questions. I really appreciate it. Take care.
You can't cut it with a boat or a plane. Man, it's gonna take a new train. You'll be leaving on a new train, far away from this world of pain. And when you look out your window, you'll see your home, your baby, and your family.